You're not going to get it in the supermarket. You're not going to get it at the gas station. You're not going to get it at your kid's football game.
Dr. Peter Bornstein is an infectious disease specialist for Health East. He says he's talked about the Ebola virus more in the last several weeks than the last several decades.
I don't think that explains the white count going up, though. That's the problem.
The first cases of the virus began near the Ebola River in the Congo in 1976. Although its fatality rate is high at 90%, Dr. Bornstein says the risk of getting the virus in the United States is very low.
I'm having flashbacks to October 2001 when we had anthrax events following 9/11. And at that time, if you may recall, that several people were infected with anthrax in Florida and Washington, D.C., New York City. It was a real thing. People were scared. Panic was everywhere. Every time someone dropped a powdered donut, there was concern that it was anthrax. I think some of the airlines even banned powdered sugar for a while because people were so nervous. This feels exactly like that.
There's no cure for the virus, which causes bleeding, dehydration, and diarrhea, but Dr. Bornstein says providing supportive treatment can be provided to those infected. And hospitals and medical staffs are working hard to prepare for worst-case scenarios.
We have the ability to contain the infection. We have the ability to help people get through it. It's not insurmountable. It takes hard work. Infection prevention is hard work. It's costly. It's time-consuming. It's something people don't think about until they need it. The people at the Centers for Disease Control have saved countless lives, but they don't know who those are because when you're in a preventive role, you're saving the lives of people who will never be identified.
Dr. Bornstein says the nurses in Dallas and the nurse in Spain are the first people ever to be infected with the Ebola virus outside of Africa. Rather than worrying about contracting the Ebola virus, he says more practical advice to take is not to smoke, get a flu shot, and wear your seatbelt.
This is the second time I've had to deal with widespread panic about a novel process that people hadn't heard of before. We'll get through it.